Good morning, everyone. So today I have two surgeries. The first one is a mastopexy, which is a breast lift, and my second surgery is a labiaplasty. And for my first patient, after pregnancy and also weight loss, her breasts sit very low, they're flat, the nipples point down. She doesn't want to change her bra size, but to have a lifted, perkier, rounder shape. Temporarily stapled the left breast, and you can see this one I haven't done anything to. You can see what a difference the lift is going to make for the overall shape, and her nipple is going to be raised on this side. You can see how much more compared to the other side. So first I've recreated a new nipple areolar complex, and I've used this cookie cutter. It measures 4 centimeters, and I've used that to make the new nipple. And now I'm very carefully removing the excess skin. So you can see this pattern is going to create an anchor shape and slide the breast tissues up into place. So just want to show beautiful final round shape, and I closed in layers, and the incision is super thin, and the areola, even though I can't show it, is a perfect circle. Putting the finishing touches on the other side, you can see just how beautiful and thin the incision is. It's a perfectly round shape, and I'm just putting the final touches on the areola to make it a perfect circle. So beautiful final lifted results, and you can see that I've created perfect symmetry. I actually took a tiny little bit around this corner to make them exactly the same. The distance from the nipple to the crease is the same. The nipple height is the same.